Okay, let me share my screen. Okay, so let's do disordered eating and eating disorders among athletes. We're just going to look at some definitions. We'll look at how often it happens, that's prevalence, um, some of the factors that lead to it, warning signs, and then how to intervene. All of these things are pretty important. If you're going to work in healthcare field coaching or athletic training or healthcare field in general, you might come across this. So even if you have kids, you have to be aware. So I think it's pretty important information. So um, both anorexia and bulimia are a nervosa. In other words, they deal with the mind. And it is the anorexia and the bulimia are both symptoms of mental disorder. So to treat the eating disorder or the disordered eating, you have to treat what's going on in their minds. Oftentimes it's a body image issue as well as some sort of negative coping strategy that they're using. So when we look at some of the details with anorexia, this is a fear of gaining weight, even though they may already be underweight, poor body image, so they appear to themselves as being overweight. They refuse to eat, or they'll hide what they eat. These anorexia tends not to do the binge purge stuff. These guys just don't eat. Or they'll eat very low calories or drink water and have like a saltine and then a cracker. That'd be all they have. One of the main signs here is amenorrhea, which is an absence of 3 consecutive menstrual cycles. This is dangerous, obviously, to have anorexia because of the poor nutrition, very low calories. Your body begins to break down pretty quickly. You can have reverse anorexia, and I put a little article here talks about this. This is basically the idea that you always think you're thin, and so you're trying to always build body mass. This is usually more prevalent in men, although it's becoming more popular in women, especially with the bodybuilding thing happening. Becoming really cut, with the muscle mass is tended. So just know that there is a reverse anorexia. We don't look at a lot of we don't look at this as often as anorexia nervosa and bulimia, but it is prevalent. Bulimia, once again, this is an episode of binge eating followed by a purge where you cause yourself to throw up or rid yourself. Sometimes they use laxatives to speed up the digestive process to clean themselves out. This is a behavior that needs to average twice a week for 3 months. So it doesn't have to be every day, but twice a week for 3 consecutive months. So a lot of times people will fit into this and not realize that it's necessarily a mental disorder. A lot of wrestlers, gymnasts, people who are trying to cut weight will practice this. And once again, this is an issue, right? But the treatments are just a little bit different. Still need counseling, still need to understand the cause and effect of this, and the consequences that come along with it. But anyway, that's bulimia nervosa. Then we have something called EDNOS. It's eating disorders not otherwise specified. And for example, you might have somebody who practices purging or binging and purging, but only does it once a week or just on occasion. Once again, not consistent enough to be a bulimia. Or you might have somebody who is practices starvation, but they do it 3 days in a row and then they kind of eat normal. And so you have a bunch of variations between all of those. And so that's EDNOS. And most of the people fall into this one, right? So they're not super consistent where it's classic bulimia or classic anorexia. It's somewhere in between. Most of your athletes will fall into EDNOS. Anorexia athletica tends to be those who exercise to an extreme where they'll eat fairly normal. Usually it's low cal, but it's fairly normal and consistent, yet they are in the low range of the percent body fat. And if you remember last lecture, we talked about that range. So it's a little different for men and women, but those in the low range of the dangerous range of a percent body fat and doing calorie restriction while they're exercising. A lot of times it's considered a compulsive exercise where they just have to, they'll drop anything to get that exercise in. There is some binge and purge in this. Most often, though, it's just a compulsive need to exercise to remove themselves of the calories. Amenorrhea can also be present here because of poor nutrition. So you're not getting enough iron, and you're not getting enough the vitamins and minerals to create the right hormones to allow menstruation to occur, or you have low red blood cells. So all of those things can contribute to amenorrhea. We also look at the female athlete triad, and I apologize for the poor quality of the image, but these don't necessarily have to correlate or go with one another, although they can be connected, as you can see by these lines. But they do happen. They do usually happen together. So if you have disordered eating, it tends to lead to low bone density and menstrual cycle dysfunction. So that disordered eating tends to feed into those two things. Not necessarily connected in any other way, although they could, if you have poor mineral and vitamin density, could lead to menstrual. You'll also see the symptoms in the bones. So this is a risk factor for females typically, but any of our at-risk athletes. Obviously, when we're talking about menstrual dysfunction, we're talking about female athletes, but osteoporosis and any low calorie issues can also affect men, obviously not the menstrual cycles. They're in the general population. If we compare between athletes and the general population, athletes do tend to have a greater occurrence of eating related issues, especially at our at-risk athletes, those who are trying to maintain a power to weight ratio. So gymnasts, wrestlers, people who are trying to move their bodies quickly over time, and not worry about the weight. So cheerleaders, things like that. So tend to have these issues. And so if you look at sport-specific prevalence, there you go. When we look at prevalence in women, it's normal for women to experience dissatisfaction with their body weight. You have a lot of social pressures. We all do, on what the demands are, what we should look like. And so when we look at that up to 60%, of female college athletes have reported some sort of adenos or disordered eating at one time or another. So it's pretty high. It's more than half. And they did a really cool study with the NCAA. We'll look at it here in a second. Prevalence in men, it does occur in men. This was a campaign that talked about body image with underwear commercials. And so these guys did a staged a protest with that. That's why that picture's in there. Once again, social demands to be built, to be strong, to look at a certain type. When you look at the percentages, about 16% are have an eating disorder. It's males. 25% of those will do binge eating. So there's your prevalence for men. So here's that NCAA study that they did. It was a pretty good one. They got over 1,000 athletes from a bunch of different schools. So 11 different Division I schools. And they looked at, basically they showed them pictures of athletes and they said, which one of those athletes do you think you should look like, or is the right body type? And then they picked them. And of course, they knew the percent body fats of the people in that image. And so they got the numbers that way. So females, the average desired was about 13%. So they picked the person that was at about the 13%. Those taking the survey, their average was 15.4. So they always looked at an image that was ideal, that was less than their percent body fat. Healthy for females athletes is somewhere between 17 and 25%. 173 of those athletes had a BMI 15 to 20, so it's pretty low. So you can see where that starts, why the percentage of 60% may have an eating disorder. Well, it's because a majority of them are going to better than average, right? The mean average would say that the body type that is most ideal is actually lower than what they have in their case, almost 2.5% lower. Male desired 8.6, their actual is 10.5. Their healthy range is between 10 and 15. So they're actually just barely within that okay range. Bulimia nervosa, 9.2% for females, only 0.01% of males in these Division I schools had bulimia nervosa. And if you looked at anorexia nervosa, almost 3% of those studied had issues with anorexia. So pretty interesting with NCAA athletes. This was a number of years ago now. I don't know, I haven't seen a recent study on this, but this was a few years ago. There isn't any single cause for eating disorders. It's just as difficult to put your finger on as you would for any sort of anxiety or depression issues. Once again, it's just a coping strategy. So how people decide to cope with different anxieties or stresses may lead to eating disorders. The stereotype of a thin-billed athlete or thin build within a thin build sport may have something to do with that. And especially if their bodies are on display, the type of clothing that they wear in the sport may influence that as well. So like the title says, it is unique to the athletes. So it just depends on their influences, the social pressures. Sometimes it comes from coaches, sometimes it comes from their peers. They looked at some of the personality tests that they did on these athletes, and a lot of them have perfectionist, people pleasers. They tend to be impulsive or obsessive compulsive. They tend to work through pain, and so they're used to being uncomfortable, and dieting like that will make you uncomfortable. They're really looking, like I said, for a power to weight ratio. So their size increase due to weight training, right? But they might be getting stronger, but they don't like the look of it. So then they may try to diet that away. Um, um, Trying to, like I said, power to weight, they're trying to be as strong as they can at the lightest. So anything other than muscle that powers us, they consider extra weight. So they try to lose it. So there's a number of things that go through athletes' minds. These are important to know, right? So if you're dealing with these as a coach, athletic trainer, as a teammate, these are the type of things that we probably ought to understand when we're going to approach people about this stuff. Warning signs. You can have an intolerance to cold just because of the lack of fat, dizziness, and constipation. Of course, your bowels are going to work differently when you're on a low-calorie diet, or frequent fluctuations in weight. In some cases, because of hormone changes and circulatory changes, you may have swollen glands and puffiness in the cheek, tooth decay, so sore throats, you may not feel well. Certainly, you're going to restrict the behavioral one. So you have physical and behavioral. So make sure that you understand the difference between the two. Behavioral, you're going to restrict food. You might even eliminate some from your diet. You're going to look to be a picky eater. And if you ever eat with people like this, they'll get a plate like a salad, and they'll push stuff around as if they're eating, or they'll eat it and then wipe their mouth and put it in a napkin and then put it in their handbag or put it in their lap so that you don't see it. So they use all kinds of little techniques to, make people think that they're eating and they're not. Typically, folks that do this talk about food a lot, in both positive and negative light, but they talk about food quite a bit. So moodiness, the withdrawals from others, those are all behavioral signs. So make sure you differentiate between physical and behavioral signs. So these are attitude signs. So make sure, what happens is that the more that they get into this, the more it's cut and dry. It's black and white. They call that dichotomous thinking. So they're either right or wrong. There's no gray area anymore in their thinking. So they're either not going to eat or they're going to eat. So that's called dichotomous thinking. And of course, they're going to deny these eating problems, especially if you bring it up to them. Their desire to be more of a perfectionist will become more and more the norm. They will be their harshest self-critic. Okay, and sometimes they just put all of their self-worth on that weight. So that's the attitudinal. So make sure that you differentiate between physical, behavioral, and attitudinal signs. So here's some of the health consequences of bulimia. Of course, you have all of the low calorie issues. So you have electrolyte issues, vitamin mineral issues. You have inflammation issues, tooth decay, uh, irregular bowel issues. In some cases, you can even do gastric rupture, where you have a rupture in the lining of your intestinal tract because of the hydrochloric acid that's you're removing from the stomach by throwing things up. So those are just a few of the many things that can happen with bulimia. Anorexia, of course, this is a slow death. So you're looking at things that will eventually kill you. So we got abnormal heart rates, low blood pressure, poor oxygenation of the cells, the reduction of bone density, poor kidney function. So the dehydration issues will be a problem. Your hair will fall out. You begin to get, because of the lack of fat along the cell, you'll start to get this growth of a downy layer of skin, like our hair, like you would see on an infant. So a lot of this is a very dangerous one. Anorexia is quite dangerous. So what you do, you really want to set a time. You want to be respectful of their privacy. You definitely do not want to exaggerate what you see, but you want to be very clear on when you saw, what happened, and when, because people are going to deny it. You certainly don't want to go to your teammates and say, "Hey, I'm going to go visit Jane about, her eating disorder, or what do you think I ought to say?" Don't make it a public thing. If you notice it, great. I would highly recommend that you would ask somebody like a counselor or some physician. Say, "I have a friend I think it's got this eating disorder. I want him to come see you. How can I approach this?" And they may be able to give you some advice. We as untrained counselors and physicians, we can certainly try to inspire somebody to go, and you can go with them to see somebody for help. But remember, right, this is not only a physical issue, but it's most certainly caused by mental disorder. So we need to get them some counseling, and we're not trained to do it. So most of us. So definitely seek advice, and then try to get your friend or whoever it is to go see that person who can really help them. Certainly follow up. Expect them to deny it. Expect them to use excuses like the demand of the sport or scholarship issues, things like that. As a coach, you should never, ever, ever emphasize weight. You should always emphasize health. You should be really aware, especially with female athletes, the need to please, and the need to demonstrate a worth on the team. Avoid weigh-ins then, and never make it a punishment to cut meals for your team. I've seen it both sides. I've seen coaches do a really good job with this. I've also seen coaches really mess this up. So definitely be aware of that. So once again, don't ask teammates what not to do. You don't want to ask teammates their opinions. You don't want to ignore the problem for sure. You've got to intervene and at least give it a try. You got to intervene and consult. That's really what it comes down to. And they're going to deny it like crazy, but just let them know you're aware, that you've seen them happen. You're going to keep an eye on them. You're really concerned about them, that you're your friend, you like them, all of those positive things that you can do and say, so that because they'll come to you for help eventually. They'll figure it out. They'll come to you for help. All right, here are your terms. Amenorrhea, 3 consecutive menstrual cycles that are skipped. Know the difference between anorexia nervosa and bulimia. Know the physical, motivational, and attitudinal signs of them. Understand the female triad. It doesn't necessarily correlate, but they tend to see them in groups. And dichotomous thinking, only because I think it's a kind of a term we don't hear very often. That's black and white thinking. So, all right, you guys. There's your chapter 12, and we're winding down here. So if you have any questions, text or email me, and we'll get them answered for you.